Welcome back to the Pelvic Health Summit. I'm here with Susie Gronski, a doctor of physical therapy. She specializes in male pelvic pain and sexual health, and she is the author of Pelvic Pain, the Ultimate Cock Block. Thank you so much for being here.
Thank you so much for having me, Pamela.
So tell me a little bit more about your practice and approach.
Great. So my degree says I'm a doctor of physical therapy, like you said, but I think I'd like to approach myself as a fun-loving human who does fun human things. And part of that is helping men who have pelvic pain get their life back. And my message is that recovery is possible, and part of that is making sure that we bring hope and recovery back on the table again for them. So my approach is pretty individualized to the person I'm working with, but it can include a combination of things like pain biology and neuroscience education, motivational interviewing and coaching, collaborative goal setting, hands-on therapy, exercise, mindfulness, nutritional and lifestyle recommendations. I know that was a lot of things I just listed, but in a nutshell, my approach really entails treating the whole person in front of me and not just their diagnosis. Pain is really complex. It's a phenomenon, really. And through vast amounts of literature that we know, it involves many facets of someone's existence. So I think it's really important to approach it through a really wide lens.
Definitely. And speaking of a wide lens, there are a wide range of conditions. Can you tell us a little bit more about the conditions that you work with and what their causes are?
Yeah, absolutely. So common pelvic pain conditions or health conditions that men face can include anywhere from pelvic pain, sexual dysfunction like erectile dysfunction, premature ejaculation, pain with erection or ejaculation, and something called hard flaccid, which is sort of, I don't think it's necessarily a new thing, but there's not really a lot of literature out there. And what hard flaccid is really about, when the male feels their penis is hard, rubbery, weird, they'll use certain connotations and descriptive words like that without sexual arousal. So in the absence of any sexual arousal. So those are some things that go along with someone who's experiencing pelvic pain. Other symptoms can include urinary symptoms like urgency and frequency, so constantly feeling like you have to go to the bathroom, painful urination, or even sometimes leaking or incontinence, but normally that's usually after some sort of surgical procedure like a prostatectomy, where that's more common. And lastly, and the most important, I think, condition that or issues that men with pelvic pain face is psychological issues like anxiety and depression, anger and hopelessness and helplessness. Dealing with pain involving your private parts is often an area of really high alert and raises a lot of concern, and there's a lot of anxiety around this issue, especially since a lot of these guys seek help and still don't know what's happening in their body or what they can do about it because they get no answers. So this could be really scary for someone going through this. We really don't know what the true causes of male pelvic pain are to this day. We definitely know it's not a find it and fix it sort of problem. We now know that there are multiple contributing triggers or perpetuators and factors that might be creating a perfect storm. And it really takes, again, a wide lens to figure out what's filling someone's cup and heightening the alarm bells of their body, and what we can do to kind of reduce that from happening.
Definitely. Thank you so much. Can you tell us more about some common myths associated that some of your patients might have come in with and you were able to debunk?
Yeah, this is a good one. So there's a lot of myths probably floating around there about male pelvic health and pelvic pain in general. But the most common ones that I hear about are that masturbation causes pelvic pain, which is not true. That the prostate is to blame for pelvic pain, also not true. And that the pelvic pain is due to an infection. It's really not. It's actually 95% of the time, it's not due to an infection. So we know we're not pointing our fingers at the prostate all the time and at infections. And also, that pain is, or the symptoms that they're experiencing is all in their head. And just because you can't see it, touch it or taste it or whatever, or the tests are clear, that doesn't mean that your pain isn't real. So that's a big myth that I hear. And lastly, and I think the most important myth that's out there is that pelvic pain is a disease or an illness that you have to live with for the rest of your life. And it's not. It's not a disease. It's not an illness. Living with pelvic pain is certainly hard, but it's hopeful and recovery is certainly possible.
Awesome. Yeah, those stories of hope, which we'll get into in a little bit, are so valuable. Can you tell us a little bit more about your book?
Yeah, so my book, Pelvic Pain, The Ultimate Cock Block, it is a dude's manual. takes someone through, what is pelvic pain and what it's not. Talks about pain neuroscience and the biology of pain in a nutshell, and then gives the reader some tips and tricks to really start to implement and practice, like breathing exercises, mindfulness, diet changes, stretches, fascial releases, hands-on external and internal techniques. So, and the book comes with some short video clips because a lot of these techniques that I describe in the book can be a little tricky to understand without some visual feedback. So it's really written in a very playful manner, not that it was meant, I didn't mean to like demean the severity of how pelvic pain can impact someone's life, but I think adding some humor and lightheartedness and hope is really going to help someone recover.
So you did touch on diet. Can you go a little bit further into some of the recommendations you're making for different kinds of anti-inflammatory diets that people can try?
Yeah, so diets are a funny thing, honestly. I think the best approach is to really work with a functional medicine provider who really looks under the hood at your biochemistry, because there's a lot of diet fads out there that might not be really good for that individual person's DNA, their cellular makeup. Maybe they're deficient in one thing and not the other. So there isn't like a one set diet for these guys. But on that note, anything that's not going to increase the inflammatory load of your body. So for example, excessive alcohol drinking, not eating processed foods, not having a lot of sugary snacks or caffeine. All these things can increase inflammation in the body and can also increase and sensitize danger sensors that are in the periphery. So we want to make sure that we're kind of at least dialing back on some of these things that might be just perpetuating the pain cycle. So basic stuff, eat healthy, eat green, get your sleep. For sure, sleep is an important one. Rest and repair and recovery happen in sleep. And if you're not sleeping well because you're up on your computer all day, or you're playing video games, or you're reading and your mind is worked, that's certainly not going to be really conducive for your repair and recovery. So those are some things that I recommend on a general basis. But anything specific, more specific than that, or I think that there's might be an inclination to gut microbiome or gut health imbalances like IBS, irritable bowel syndrome, or Crohn's, or constipation. Those things need to be cleared for sure, because there is an association with pelvic pain in those health conditions. So we want to make sure that we're working with, a functional medicine provider or a healthcare provider that can help kind of minimize some of those triggers that might be perpetuating their pain cycle.
Awesome. Yeah. In this summit, we've been talking a lot about the importance of having a whole team around you. And you did mention the functional medical doctor. Do you have other practitioners who you work very closely with in your practice?
Yeah, I collaborate with a lot of different practitioners to help men navigate out of pain. And you're right. I think having a really solid wellness team by your side when you're navigating and recovering is super important. And other providers I work with are urologists, making sure that we're cleared of any red flags, obviously big ticket items, functional medicine providers that I've mentioned already, gastroenterologists, sex therapists, and psychologists. So people who work with like cognitive behavioral therapy or acceptance commitment therapy, those have been shown to be really helpful when you're navigating out of persistent pain. Acupuncturists are another provider that I work with, and nutritionists.
Thank you. Can you kind of elaborate a little bit more on what some of those big ticket red flag items and conditions are that you like to eliminate before a patient can pursue physical therapy?
Sure. And I'd like to preface that, they can definitely see physical therapists, before seeing a urologist, but most physical therapists will say, well, let's just make sure there's no STDs, no sexual transmitted infections or diseases. We want to make sure we're not dealing with, big word, but cancer, scary word, we just want to make sure that's cleared. Any other types of infections that might be perpetuating the pain cycle. So, or bladder infections for that matter too, not just the prostate, but the bladder as well. Skin conditions, we just want to make sure that there's anything that really needs to be addressed by the urologist. And if everything comes out clean and negative, at that point, then it's like, okay, let's move on to other multimodal treatment therapies that will help someone out of pain. That being said, the sooner that someone gets help and the correct help and the right message, the better off they are. So within the first 6 months of the course of care, if they feel completely satisfied and they have a wellness team that's super supportive, it will be less likely that they will experience pain 12 months from then. So really important to make sure that you're working with providers that understand what's going on, that can explain what's going on to you, and that can help you create a plan together with you. It's not just power over you, telling you what to do, but really collaborating with you on a journey towards recovering so that your alarm bells can actually relax and things can heal and you can finally, get your life back.
Definitely. Can you tell us a little bit more about the patients who you treat? Do you specialize? Are you seeing everyone from athletes to seniors to maybe teenagers? What's the range? Or do you see a common theme and maybe it's a certain kind of athlete who comes in very often?
Mm-hmm. Sure. Yeah. So the kind of patients that I see in terms of demographics, they range really. I think right now it's late 20s, 30s, late 30s, but that doesn't mean I don't see younger. My youngest patient I've seen was 6 years old, and he had, incontinence and, constipation and whatnot. But my oldest patient can be in their 80s. So it just depends on the person and whether or not we're a good fit for one another. I also see women who have pelvic pain, women who experience incontinence, prolapse symptoms, constipation, that sort of thing. So I see a little bit of both. My main practice is focused on male pelvic health.
Fabulous. Can you tell us a little bit more about some of the things that people who are watching from home can do to either address their current pelvic pain or possibly prevent it from getting worse?
Yeah, and I like this question, honestly, the precautions that someone could take to really help with what's happening, whether or not they don't have it or whether or not they want to prevent it in the future. And I think the reality is honestly, we can't avoid pain. I mean, we have a human body and we share the same human, condition. So on that note, pain is normal part of life, but I also acknowledge that living with pain is certainly not normal, nor is it pleasant for anyone to experience. So on that note, I believe that the best way to prevent pelvic-related injuries and issues is really not to be afraid of pain in general. It sounds counterintuitive, but the fact is that we can't necessarily be certain of when we'll experience pain or any other health-related issue for that matter. So it's important to stress here that the reaction and the steps that we take in response to pain can really change the perception of what's going on. And that can either lessen the alarm bells going off, which will help with your healing and recovery, or it can work against you in a maladaptive way, which will then perpetuate the pain cycle. And then you find yourself in this hamster wheel. I like this saying from some of my mentors, Dr. David Butler and Laura Mosley, nerves that wired together, fired together. And that's all about, again, that pain science of how does pain really work and where does it come from? So that's a whole nother topic for a whole nother day. But just understand that it's a very complex and multifaceted experience when somebody is in pain. So there's no set protocol or guideline to kind of, prevent pelvic pain. Obviously, if you're reckless, participating in reckless activities like unprotected sex and not taking care of your body to optimize health, then these things can eventually catch up with someone and lead to more than just, I'd like to say, just pelvic health related issues. You're probably going to deal with other issues too. But again, you have, individuals who might have had an accident or, fallen on their tailbone or had terrible car accident and everything heals and they don't have persistent pain. And that's kind of where we have to kind of think, well, why do some people have pain and others don't, given different circumstances or the same circumstances? So that's kind of my 2 cents on that. And I also encourage people in pain not to stop doing the things they love for fear that they might be hurting themselves even more or damaging something even more, which is why it's important to really work with a provider who's going to say, hey, let's start doing the things you love to do, and let's dose your activities appropriately so that you can feel that you're really working up towards your goals of being pain-free. There's a lot of fear mongering going on. I'm sure you know that, everything's about don't do this or do that, or that's bad for your health. And, the next day it's good for your health. And so there's so much out there that can be really information overload. And a lot of times it's not quality information either. So, just really do your research, take the, be empowered to take your health into your own hands, get second opinions, make sure your providers are all speaking the same language. And honestly, making sure you're connecting with people that are listening to you and really taking you seriously. Because with pelvic pain, sometimes, sadly, healthcare providers don't always take them seriously because nothing shows up on scans. So that's when you start getting, well, it's all in your head, or relax, or drink some wine, or, those are some of the things I've heard from patients literally as advice. So I really feel for everyone who is going through pain. I myself had that experience as well. So, and which is why I bring a lot of my own experience and my own strategies to the table that have helped me in hopes of helping others. So.
Definitely. Well, thank you for sharing all that. And I would love it if you could share some patient success stories just to infuse some hope for our community.
Yeah, it's great. So I have I have lots of wonderful patients, let's just put it that way. But I had one gentleman in particular who came in, had testicle pain, growing pain, and had surgery because they thought it was a hernia. It wasn't a hernia. Long story short, he finds me, and he already went to another pelvic floor therapist. Again, nothing against people who are trying to help other people. We do what we can with what the knowledge we have and the tools we have. And he was devastated because he was told not to do what he loved. He was told not to exercise, stop biking, stop rowing. He even stopped traveling. This person was very active and was told to stop everything. And that certainly wasn't helping him. So he comes in very distraught. And I start to explain to him, hey, this is going to be okay. This is what's potentially happening. I explain a lot about pain biology so that the person can understand what we currently know about pain and how it manifests and what are the contributors. And I kid you not, 99% of his pain was gone walking out of my office. I didn't even put my hands on him. So it's that there's something much deeper to someone's experience of what is the protective mechanism at play? Is it a valid protective mechanism? Or perhaps is it because there's still a lot of fear and there's a potential threat that is perceived in that person? And so naturally the body's going to be in fight or flight. So, he's been doing great ever since. I mean, we just do coaching now to help with other health issues and relationship issues. So it's great. Other success stories too, sexual dysfunction, premature ejaculation, it's all about the nervous system and really educating the person on what's going on in their body and being able to kind of utilize certain strategies and applications in their life, and then helping them along the way, not just in the clinic, but having that ongoing support even after hours. And that's what I offer to everyone too, saying, hey, I'm here with you along the way. If you need help, you reach out to me, so that they don't feel alone. They don't feel like they have to be embarrassed about reaching out. So I know I could keep talking, but we'll probably be on here forever.
Yeah. Would you mind telling us a little bit more about your coaching practice?
Yeah, so, it's intertwined with my pelvic health practice. So I use motivational interviewing and Socratic dialogue techniques, a little bit from, acceptance and commitment-based therapies and mindfulness. Because really, the brain, the nervous system, the mind, and the body are connected and work together. So we can't address the physical without addressing the other stuff too. And it just depends on the person. how much of that they need. It could be biological, psychological, sociological, and you as a practitioner, my job is to figure out how much of each bubble does someone need to work on. And perhaps it is a lot of desensitizing their tissues and doing hands-on work and safe, non-painful manual therapy. And other times it's exercise. Other times it's like with the gentleman I described, it's really kind of just educating someone about pain and that this isn't going to be forever, and giving them hope that really starts to make the shift in the nervous system and the brain, because without the brain, there's no pain, period. So there are structural things that happen, which most people, this isn't common knowledge for most people. And even, healthcare providers, they're not really well versed in modern pain science, so it's important really, again, to ask the right questions. And I empower people to do that when they're working with healthcare providers. How do I know that I have an extra sensitive nervous system? Is this a tissue issue? What are other things contributing to my pain? And really resources, there's a lot of educational tools out there and workbooks and videos that one could watch to learn more about pain biology and really rethink how they think about pain. And that's the beginning of the journey, to be honest.
Awesome. Can you share some of your go-to resources that you like to recommend to your patients?
Yes, go-to resource. Explain Pain is a book by David Butler and Lorimer Mosley. They are leading pain scientists. So they're clinicians and they're scientists who study pain in humans. Another good workbook is Why Do I Hurt? ? That's a workbook. Adrian Lowe is the gentleman who wrote that. And another of my favorite books I have some of them here, actually. Sorry, hold on. My go-tos. I'll give you my go-tos real quick here. Oh, stay. Okay, so I don't know if you can see. Can you see this?
Yes.
Yeah, this is the book that I was talking about, Explain Pain. This is, obviously, my book. This is that one. So I'm going to plug that one in. This is another good one, Why Pelvic Pain Hurts. Very tiny read, but it goes through explaining pain in relationship to pelvic pain, and it's by Adrian Lowe, Sandra Hilton, and Carolyn Van Dyken. Usually I give this book in addition to this workbook, Why Do I Hurt workbook. And it takes them through step by step of how to debunk some of the misconceptions around pain and why they hurt, and how they can utilize certain strategies to retrain the nervous system, relax extrasensitive or calm extrasensitive nerve impulses, and the nervous system extrasensitive nerves. So yeah, those are some of my go-to resources.
So you mentioned the flight or fight response. Can you please elaborate and tell us what that is?
Yeah, the fight or flight response. It's kind of like the Mike Tyson of your nervous system world, right? So you have the Mahatma Gandhi, which is the rest and digest, and then you have the Mike Tyson who's ready to fight. So you have fight, flight, or freeze, and it's part of the autonomic nervous system, which is a protective mechanism, right? If you've got a bear chasing after you or Mike Tyson ready to fight, you're not just going to be like, well, let me think about this and kick back and relax. No, you're going to like kick in and react, because your organism, you as a human, need to survive. And certain psychological issues physiological issues start to happen. Your heart rate increases, your respiratory rate increases, you're breathing heavily, you start sweating. Blood is diverted away from the digestive tract and reproductive organs so that it can go to your muscles, your legs, your brain, your eyeballs. So, all of those things happen to protect you for survival. Now, it's great to have because you want to make sure you're darting out of danger, but chronically, not so much, because then the stress hormones that are released in the circulatory system, the endocrine response, the immune response that starts to happen can actually work against you, not working for you, but against you at that point. So it's great to have short term, but long term can really have an impact on your health.
Fabulous. Thank you. I will link all of those in the group. Can you please tell us how we can work with you both locally and internationally?
Yeah, absolutely. I do virtual consultations online for those who are international. I have a in-person 6-day hands-on training program that is customized to the person. So if anyone wants to visit me in Asheville, it's great because I can actually be your provider. And since you're seeing me in person, it's a little bit more customized. There are little hiccups with international if you're not seeing me in person because I can't really put my hands on you, so it makes it a little difficult. But yeah, so the 6-day hands-on training program, or just coming in for immersion sessions, or, you know, it just depends on the person, their financial needs and what they can do. So, you know, if you're local, awesome. If you're from far away, you can still come and visit. We can definitely set up something that works well within your budget and within your travel time and all sorts of fun stuff.
Awesome. And how can we connect with you online?
So I have Facebook, Dr. Susie G. or Dr. Susie G. Twitter, which is Dr. Susie G. Instagram, it's Dr. Susie G, but with a period, so dr.susieg. And my website, drsusieg.com.
Awesome. I'll link all of that. Thank you so much. It was a pleasure speaking with you.
Thank you so much, Pamela. I'm so glad to be part of this Pelvic Health Summit.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.